And finally, on the program, the Lagos State government has asked health workers in the medical sector to support the State Health Management Agency, LASG, for the domestication of the new NHIA Act in the state. The government believes that the insurance coverage will indeed help guarantee basic healthcare services to residents of the state and urge providers to ensure compliance to the Lagos Health Scheme law.
The Nigerian government signed into law the new National Health Insurance Act NHIA 2022 on 19th of May 2022. The NHIA replaces the National Health Insurance Scheme Act of 1999, which failed to enroll more than 10% of the population. The NHIA seeks to promote, regulate, and integrate health insurance schemes. In Lagos, the state is taking a bold step to domesticate the new NHIA Act for its residents through the State Health Management Agency, LASG.
Of Lagos State residents.
The agency is holding its first health insurance summit at Civic Center, Victoria Island, Lagos, to blaze a new course in the state health sector.
The Lagos State Health Management Agency over the past 3 years has tirelessly and intentionally worked in creating enduring structures, operationalizing the social health plan's implementation, exploring innovative strategies and initiatives in advancing the cause of UHC. Concerted efforts have also been made to increase coverage while leveraging on technology and partnerships, which we thankfully enjoy a preponderance of. Certainly, we wouldn't have made these strides and come this far without the support of the state's #1 UHC champion, Mr. Babajide Olusola Sanwo-Olu, for which we sincerely thank and appreciate him. As we ponder upon the challenges ahead, we must also recognize the tremendous potential this sector holds. By leveraging technology, data-driven insights, and innovation, we can reshape the future of healthcare in Lagos State. It is important to emphasize that the implementation of a social health insurance program neither stifles nor represses the private health insurance space, as they both complement each other. In the spirit of universal health coverage, by catering to different segments of the population. Succinctly put, we are allies working towards a common purpose, providing accessible, efficient, and high-quality healthcare to all residents of our dear state.
The United Nations International Children's Emergency Fund and other stakeholders in the health sector are ready to support the NHIA implementation scheme.
So UNICEF is really happy to be here to join forces with the Lagos State Health Management Agency to see that every child is covered with health insurance. One of our mandates as UNICEF is to ensure that children, the rights of children, are protected everywhere. And we're very particular about the most disadvantaged. And so you can see that our mandate aligns with that has been mentioned today by our permanent secretary, which says that no child, no one should be left behind. For us to do this, we need enabling policies, laws, and guidelines.
We are not talking about what is the coverage of NHIA in Nigeria any longer. We are talking about how many lives are covered. So nobody is looking at the picture of NHIA. We are looking at what each state is doing. We are looking at what NHIA is doing. We are looking at what HMOs, private schemes, what they are doing. And at the end of the day, we'll be able to say this is a total number that has been covered in Nigeria. And the CEOs are committed to that. We are doing well in the area of basic care provision fund. We are doing very well in the area of each state coverage. And I can assure us here this morning that whatever it takes, the commitment, the strength, the energy that it takes to ensure that Nigeria's story in terms of health is rewritten. The CEOs Forum, we put strength to that and work with all available stakeholder partners to ensure that we're able to change the story around our health system story in Nigeria.
The LASG board chairman encourages the public to key into the Ilera Eco initiative and enjoy universal health coverage.
The establishment of Lagos State Health Scheme is a very laudable one, and I am very convinced it is the ideal model to ensure that all residents of Lagos State have access to quality and affordable healthcare services. The commitment of Mr. Governor in steering this project towards attaining universal health coverage for all is unrivaled and is much appreciated. Under my leadership and with the teaming support of all board members, permanent secretary, and all the entire management, we will ensure a sizable proportion, if not all in a short time, all Lagos residents are enrolled on the scheme and have access to quality healthcare services.
How to accelerate social health insurance coverage is also highlighted.
We need to be very deliberate about growing our pool to make sure that Lagosians who can pay are paying, because the fundamentals of health insurance or any kind of insurance is cross-subsidization. Those who are healthy, young, productive need to contribute to the pool so that those who are less healthy, less productive, you can equalize the risk and you're able to provide care to everybody. Universal health coverage is a journey, not a destination. When you are able to cover the entire population of Lagos under the current scheme, what do? You start striving to expand the benefit package. There is always something to do with UHC. So it's a journey, is not a destination. So which means we need to continuously review our performance framework to update our KPIs to be sure that when we meet one target, we evolve to the next target to continue to push through this. The state health insurance agencies must know how many people are insured in their states, irrespective of who is providing the insurance. Otherwise, how do they plan for the entire population? The same way the NHIA needs to know the total number of people insured in the country, whether by state schemes or by HMOs or by federal schemes. It's a must. Our current enrollment figures, national, from the last figure I heard in an NHIA meeting was about 17.8 million. So which means you will increase our health insurance coverage by 300%. Now, this you can track. You can say who got it. The impact you can measure. Citizens will be happy with us. They will vote us in the next election. Donors and partners will be happy with us. Then look at the effect on the sector. The pharmaceutical will manufacture more because there is guaranteed financing. There will be more employment.
Permanent Secretary from the State Government of Health, Dr. Olusegun Ogboye, reads the governor's speech.
We're committed to ensuring that all other residents of the state are not left behind and are duly enrolled on the Ilera Eco Health Plan. To this end, I have issued an executive order for the commencement of the domestication of the NHIA Act and the implementation of the LSHS. This will make it possible for the agency to engage with all key stakeholders and ensure that residents of Lagos State have access to quality and affordable healthcare services, thereby moving the state closer to the attainment of universal health coverage. In recognition of the fact that a sizable proportion of residents of the state may not be able to afford the health plans, we have committed a minimum of 1% of the consolidated revenue fund as equity fund to the Lagos State Health Fund to provide coverage for vulnerable groups by purchasing Ilera Eco plans. The equity fund has been approved as a first-line charge for coverage on Ilera Eco. To complement this, we have also established the Eco Social Health Alliance, ECOSHA, as an alternative financing mechanism for increased access to health, social welfare, and empowerment among vulnerable residents in line with our commitment to the principle of inclusivity and social protection. We are currently building new health facilities, remodeling and equipping existing ones, especially our general hospitals, whilst making sure that they have adequate manpower to provide the services expected of them. The government also intends to commit resources to creating public awareness and educating Lagosians on the benefits of health insurance and the need to maintain a healthy environment at all times.
With the domestication of the new NHIA Act and the launching of the Ilera Eco virtual booth, The State Health Management Agency now has more work to ensure that Lagosians get on board and take advantage of the universal health coverage.